Hi, I'm Ethan.
I'm Jerry. We'll be doing the palpations of the cervical thoracic spine. What class is this?
Kinesiology 2 with Jane Worley.
And the first part of our palpation will be the occiput. The occiput is the posterior portion of the skull. Within the occiput is the inion. The inion, a dome-like shaped bump, sometimes called the bump of knowledge, lies in the occipital region on the midline and marks the center of the superior neutral line. The superior neutral line, if you move laterally from the inion to palpate the superior neutral line, which is a small transverse ridge extending out on both sides of the inion. The mastoid processes. As you palpate laterally from the lateral edge of the superior neutral line, you'll feel rounded mastoid processes of the skull. The spinous processes of the cervical vertebrae. The spinous processes lie along the posterior midline of the cervical spine. To palpate them, cup one hand around the side of the neck and probe the midline with your fingertips. Since no muscle crosses the midline, it is indented. The lateral soft tissue bulges outlining the indentations are composed of deep paraspinal muscles in the superficial trapezius. Let's see. The C7 and the T1 are found by the larger bony processes compared to the other ones. The facet joints from the spinous processes, for example T2 or C2, move each hand or move laterally about an inch and begin to palpate the joints of the vertebral facets that lie between the cervical vertebrae. Facet joints.
So now we're going to palpate the ribs. First of all, we're going to start out with the second rib, which you go from the superior angle of the scapula and you come across about 1 inch and feel in the soft tissue you can palpate the second rib. Then we're going to look at the T3 spinous process, which you go from the spine of the scapula and come right across and feel for the bony prominence of the T3 spinous process. Then we're going to look at the seventh rib. To find the seventh rib, you want to go from the inferior angle of the scapula and come across to the T7 spinous process, and there will be, in the soft tissue between those, is the seventh rib. After that, we're going to cover the scapula, which is 2 to 3 inches from the spinous process laterally, and you can feel the bony prominence of the scapula all throughout this region.
So our next palpation will be the upper trapezius and the middle trapezius. The upper trapezius can be palpated from the occipital bone down to the upper cervical spinous processes, and it attaches to the outer third of the clavicle and the chromium process. The middle trapezius is from the spinous process of C7 down to T3 and attaches on to the top scapular spine. So the middle trap and the upper trap. Posterior lymph nodes can be found from the middle of the occiput moving down to the C2 and moving straight across to the back of the ear. You'll find the posterior lymph nodes. Next, the greater occipital nerve is a spinal nerve. This nerve arises from between the first and the second cervical vertebrae. It ascends after emerging from the suboccipital triangle obliquely between the inferior oblique and the semispinalis capitis muscle. This clip shows a cutaway view of the suboccipital triangle.
Now we are going to tell you how to palpate the superior nuchal ligament. This ligament starts out from C7 and goes up to C1. And as you palpate between the bony spinous processes, and you can feel it as a soft tissue. After that, up next is the suboccipital muscles, and these are below the occipital bone, and they go from the occipital bone to the C1 spinous vertebrae. And each one of these muscles connect from the suboccipital bone to the C1 and C2 spinous vertebrae, and you can palpate them as soft muscle tissues in that space. The anterior palpations. Starting out is the mandible, which is actually your lower jawbone, which starts from here, comes down and up around to form your chin. And the mandible comes all the way from this side across and back up to the other side, forming the lower part of your jaw. After that, we're going to talk about the angle of the mandible, which is right here on the back side, right below your ear. If you palpate, you can feel all the drop off from the angle of the mandible. So now we're going to talk about the suprasternal notch. This is the beginning of the sternum, right at the superior part of it. Right below that is the manubrium, which is the main beginning part of here, which is just inferior to the suprasternal notch. If you keep moving inferior, you get to the body of the sternum. This is the main cartilage point for the connection of all the ribs. Below that is the xiphoid process. It is very easily palpable of where you can feel the ending of the soft tissue where the xiphoid process of the sternum meets. The sternal angles are right where rib 2 connects, right at the top of the suprasternal notch. You can actually feel these angles and they're very palpable. From there, we are going to talk about the sternoclavicular joints, which you follow right along here, and this is where your clavicle meets your sternum. As you can see, when you raise and lower your hand, you have a slight movement of the sternoclavicular notch, or joint. The ribs, which come from the sternum back across to the spine, as you can see, you can palpate them as bony prominences on the side of the chest. What you do is you can just feel along, if you slide your fingers, you can feel each bony prominence of each rib coming up across all the way from the top to the bottom.
Next, we'll be palpating the lymph node chain, which is located on the medial border of the sternocleidomastoid. The thyroid gland cartilage lies in a central position along the anterior midline of the neck, anterior to the C4-C5 vertebrae. The thyroid gland overlies the cartilage in an age pattern. The carotid pulse is palpable at this point with the tips of your fingers as such. Parotid gland partially covers a sharp angle of the mandible. If we turn to that side, it would be right here. The supraclavicular fossa lies superior to the clavicle and lateral to the suprasternal notch. And that's the supraclavicular fossa.
The first cricoid ring, which is inferior starting the first ring of cartilage that you can feel that is inferior to the hyoid bone. The sternocleidomastoid muscle starts from the mastoid process and comes down and inserts into the sternum. As you can see, this muscle comes right up and down from here and is easily palpable in the muscle belly.
Okay, what grade are you in right now?
What grade?
Yeah?
5th grade.
And who's your favorite teacher?
Jane Worley.
And what's your favorite subject?
Kinesiology.
What's that?
That's when you learn about bones and muscles and other sorts of stuff like that.
I see.
Alright.
Do you have a favorite girlfriend?
No, but I have a fiance. Is my teeth bad? Hi, I'm Ethan.
I'm Jerry. We'll be doing the palpations of the cervical thoracic spine. What class is this?
Kinesiology 2 with Jane Worley.
And we're actually naked from here on down.
Yes, we are. Alright. After that, I'm going to talk to you about the hyoid, which is another name for it is the Adam's apple. It's the beginning cartilage right up here of the trachea. A good way to find out where it is you can start from C3 of the spinous processes and come around, and it should line up exactly with it. After that, we're going to talk about the suprasternal notch. The suprasternal notch starts right up above here and comes across, which is the beginning top part of the sternum. Right below that is the manubrium. In the manubrium, to palpate the ribs, as you can see, all of our ribs are like a cage-like on our... Oh, jeez.
Next we'll be palpating the lymph nodes, the anterior lymph node. The lymph node chain is situated along the medial border of the sternocleidomastoid muscle.